honestly, it was I didn't really know exactly what to do with my life. I knew I was very interested in health and especially in a physical way and holistic health in particular. And it really has everything to do with my nephew, just because as long as I can remember, my nephew growing up, he was very, very sick. His name's Isaiah. And literally from the day he was born, he was just constantly sick. And he was that kid that just always had snot coming out of his nose. He had terrible sinus infections, ear infections, asthma, eczema, just on and on. He was just always sick, always on medications, some sort of cream, antibiotic, what have you. And it actually turns out at 3 years old, it was Christmas time, he ended up having a stroke. And so, yeah, at 3 years old, he had a stroke, and obviously it took him to the hospital and everything. And they just weren't very helpful. They didn't give any kind of solutions. They basically said, here, we'll take these certain medications and just monitor it and see if it ever happens again. So my sister, super frustrated. She's actually a pharmacist. And so she had literally done everything they'd ever asked her to for his health. And up to that point, he was still just constantly sick, constantly on drugs, and almost died of a stroke. So at that time, a friend of hers sent her to her chiropractor. My sister said, why would I take my 3-year-old to a chiropractor? He doesn't have neck pain, doesn't have lower back pain. But literally just because she had no idea what else to do, she went to that chiropractor. And that chiropractor ended up checking Isaiah's spine. And basically what he found was that he had a misalignment in the 2 top bones in his spine. And he explained to my sisters, like, that bone being out of alignment, it's affecting the way that his nervous system is able to function, right? And so for the first time, somebody told my sisters, like, there's just nothing wrong with your son. He's not destined to be sick and on drugs the rest of his life. We just need to fix what caused the problem in the first place. And so from there, he started getting him adjusted. And over the course of the next 4 years, was able to reverse all those things. So no more sinus infections, ear infections, asthma, eczema. And because he had that stroke, they've done test after test, and there's just literally nothing there, right? He's the picture of health and a now 7-year-old little kid, all because somebody looked to see what was causing the problem as opposed to just covering up some symptoms. And I was already started down that road of thinking, how do you fix the cause of things as opposed to just covering up symptoms. But after watching all that, I said, that's exactly what I'm going to do. I'm going to go off to school. I'm going to be a chiropractor and be able to find and fix causes. And long story short, my wife and I both went to Palmer, Florida, in a chiropractic college in Daytona, Florida. And and so from there, we ended up opening our health center 2 years ago. And so we teach other things outside of chiropractic. Just because it takes an awful lot to be healthy in life these days, right? So we look at things like nutrition, exercise, toxins in your life, and even just your overall mindset and the stresses that you have in your life, just because all of those things can be adding up to be building health, or they can be taking away, leading to sickness, and then adding chiropractic on top of all that. So that's really what got me started and got me passionate about health and in chiropractic in general. And luckily enough that we have a friend, it was actually Dr. Tiffany. You guys you know who Dr. Tiffany is, but we knew her through one of our networks of chiropractors, and she introduced us to the Dream Center. And from there, shortly after we opened our clinic here in Colorado, we started off with the Dream Center. So we've been there for about 1.5 years, almost the same amount of time that we've been open. So it's been really fun.
Wow. Okay. I love that story on so many levels.
Sure.
I do. And I love that it's personal, because I think when we have our why identified, it really does help us to understand and to keep pushing through, right? When
Absolutely.
And those seasons like COVID-19, when we're wondering in our heads, how are we going to do this? But understanding that why is just so key. So thank you for sharing that. And my goodness, we will continue to lift up sweet Isaiah there.
He's doing great. They live just north of Denver, so he's been doing great. They still go to their chiropractor once a week, every other week now.
I love that. Okay, that's one of my questions to ask you. Frequency of chiropractic care, is that something that is every day for the rest of my life? Is it seasonal? How would you describe chiropractic care?
Okay. Yeah. So before we jump into frequency, you really have to understand what chiropractic is and what it's meant to be, because a lot of people view it as just a pain symptoms basis. And so when my lower back hurts, I go in and I get adjusted. But that was never really what a chiropractic was intended to be. It was always supposed to be a different way of viewing and managing your health, right? So in chiropractic, we recognize that there is an intelligence in your body that's constantly working for you, keeping you alive, right? And super easy ways of looking at it is like, you don't have to tell yourself to breathe. You don't have to tell your heart to beat. You don't have to tell yourself to digest and all that. And so we recognize that there's an intelligence that's constantly fighting for you, adapting, keeping you alive. But we also recognize that intelligence, the way that it works is through the nervous system, right? And through the brain and through the spinal cord. So like everything in your whole body, you guys already know this, but for your heart to beat, for your lungs to breathe, digest food, even for you to be pain-free right now, it's like your brain has to tell that part of your body what to do. And the only way that happens is that your brain sends signals down your spinal cord and then out the nerves to every cell, every muscle, tissue, organ in your entire body, right? Now, as a chiropractor and in chiropractic, what we do is obviously we check spines, but the reason why is because your spine is designed to surround and protect your spinal cord. And then every nerve in your whole body starts at your spine and then branches out. And so when there's a misalignment in your spine, it has the potential to put pressure on one of the nerves that exits there, right? So a big part of that is, so if you have pinched nerve that goes to some part of your body, your brain simply cannot tell that part of your body what to do properly. And so it starts to malfunction, right? And now part of all that is immediately we start talking about pinched nerves and you start thinking pain, right? And so that's just the way most of us has been trained. But problem with that is that your body the nerves in your body, only 6% of them feel anything at all. Right, it's the other 94% of your nervous system that's just there for function and healing your body. So chances are you're not going to feel anything. And if you do feel something has gone wrong, and it could be affecting other areas that those nerves go out to. So yes, chiropractic is very good at helping to treat pain and symptoms of like numbness and tingling, sciatic pain, whatever it is. But that pain is just a symptom that something has gone wrong, and it could be affecting other areas of your body, right? And so to answer your question about frequency, it really just depends. It depends on where you're at, how misaligned is your spine. Is it something that is easily corrected? Is it something that's been building for multiple years? Because oftentimes what I find is that people have had issues that have been building for multiple decades, and they were waiting until they felt something before they got checked out. And at that time, it's been there for 2 decades. So 1 or 2 adjustments simply just isn't going to fix anything, right? It's like saying you ate fast food for the last 20 years and I'm going to eat a salad and that's going to fix everything, right? It's simply not, right?
Not back to Mark. Don't get
we won't go into fast food. Anyway, yeah. So the whole concept is that whatever's going on in your spine, we need to correct it first. And then from there, it's mostly about maintaining, right? And so most of our patients, they elect to come in at least once a week just to maintain their spine. So whether it's undoing things in the past or just preventing things from coming up in the future, and literally just undoing life as it happens, right? So we've seen this through this coronavirus thing, that people have just been sitting a lot more, sitting at their kitchen tables, doing work if you're working from home, just abnormal stresses on your spine. And so it's literally just being able to prevent those things and undo them as they're coming. So I know I didn't directly answer that question, but it really just depends. But I always recommend at least once a week just to keep you where you are and then help to improve slightly as you're going along as well.
No, I appreciate it. I think you did answer it. And the reason I was asking it as well is, in our services, our holistic care at Dream Center's Women's Clinic,
sure.
We don't want a one and done. We don't want anyone to walk in and feel like one time, check the box, and like
exactly.
You said, the salad's going to undo 20 years.
Right.
We want to say that holistic care is really the whole body, and you so quickly addressed that it is the stability of the physical, the mental, the emotional, and
absolutely
to be able to do that. And so we want to invite people to think that this is a long term, right? This is a
right.
This is a journey that we're on to walk alongside the women of the Women's Clinic. And then I know specifically you have had the opportunity for Dream Center's Mary's Home, the moms that are able to come over there. In fact, one of our volunteers just this morning was going on and on about what a privilege it is because she gets to drive some of the moms from Mary's Home over to the clinic to get chiropractic care, and how, again, the approach of Dream Centers, that holistic approach, really is saying, hey, this is a journey and we want to take the journey with you. So thank you.
Right. So many people think that you can just, once you have a problem, you just do whatever it takes to solve that problem and you're done until the next problem comes. But more often than not, we find in health in particular, and holistic health, it's a lifestyle. Right, it's a long-term lifestyle. I say it all the time. You're either moving forward or you're moving backward in your health. There is no sitting still doing nothing. So if you're not actively taking care of your health, you're actively moving backwards. So that's a good concept with that holistic concept, is that it's like, hey, you just got to be taking care of yourself and your entire family for the rest of your life if you want a different outcome than we're seeing in our country right now.
One of the questions that we received this morning is, can you get too much chiropractic care?
So the short answer is yes, right? In that we want to be as specific as possible. And that's why we always ask if somebody's seen a chiropractor before, what kind of care have you gotten? Have you gotten x-rays? What are they doing? What kind of treatments were they doing? Just because sometimes a chiropractor can get a little bit lazy. And I don't mean to put any other chiropractor down, depending on what they're doing, but we're all trained really well. It's just, how committed are you to making sure that you're doing the best job possible? Now, my wife and I, we get adjusted at least 2 times a week, and it's literally just undoing life as it happens. But there are certain cases where some people need to be adjusted less, and certainly, so about half of our practice here in our office is children. And that looks very different for a child getting adjusted versus an adult that's been building degeneration for 50 years, right? So frequency is definitely less there, but it's all about supporting and just checking in regularly to make sure that everything's still progressing and holding the way that it should.
I'd love your fresh eyes perspective. You serve at our women's clinic, the Dream Center's Women's Clinic, and I would love any thoughts, insights about the program that you'd like to share from a male perspective.
Sure.
A service provider that comes there to volunteer.
Yeah, I actually talked to our team about the Dream Center a lot, just because it's such a loving environment. First of all, what the Dream Center itself has created, and just the openness and the counseling and the prayer rooms and all that. I mean, it's just so open and inviting. But just from the women coming in, I mean, honestly, how grateful they are more often than not, and just being able to experience their life a little bit with them, and so. Yeah, I've honestly, it's been a blessing for me to be able to be a part of the women's life there at the clinic, and just kind of growing with them I've had some people that have been there for the entire time that I've been there, which is now over a year and a half. So it's been really cool just to be a part of their lives and hear their stories and what they're struggling with and what they're improving on, all that kind of stuff. So it's been really a great blessing for me.
I love that. One of the things I jotted down is that you fix causes. That was one of your quotes, fixing causes.
Right.
How does chiropractic care help to address some of the causes, if you will, from some of the women who are coming into the clinic or from Mary's Home who have experienced difficulties, traumas in the past? How does chiropractic care address and help those causes?
Sure. And so, I mean, it really depends on what the trauma was, right? So, I mean, in chiropractic, we say there's emotional, physical, and chemical traumas, and all those things can affect your spine and in different ways. I won't get into the science behind it all, but all those things can affect your spine in a different way. But no matter what, it always comes back to that standpoint is like, okay, is your brain simply able to communicate well with your body? And if your brain is not able to communicate with your body, then if you have those emotional traumas, you're not going to be able to process them as well. If you have physical traumas, there's going to be issues biomechanically, there's going to be issues physiologically, chemically. Your brain, if your brain can't tell your body to remove those chemicals properly and how to balance your hormones through that, then there's always going to be an issue. So that's why even when we go through and we talk about the other aspects of health with nutrition, exercise, we always start with chiropractic first. And that's always because of the nervous system, right? You could eat the best foods in the whole world. You could be eating kale and broccoli for breakfast, lunch, and dinner. But if your brain can't tell your digestive system how to use those good foods, then it simply doesn't matter. It really always comes back to how well is your body functioning, right? And so we always start with chiropractic first, saying let's make sure that your spine and your nervous system are free and clear, that's not a potential cause. And then you move into the nutrition. Are you eating the right foods? Are you exercising? Are you moving your body? Because a lot of times what we see is that people get great results with chiropractic care, but they don't plug into any of the other health aspects. And so there's always going to be continued issues. So just being able to help people fix their nutrition, because again, if you're coming in and getting adjusted every day, that's awesome. But if you turn around and go to eat McDonald's immediately after your adjustment, you're still having an issue with your health, right? And so a lot of that is just all-encompassing. How do we remove all the small things in your life that could be causing interferences with your body's ability to heal itself?
Great answer. Great response. So hand in hand, who would you say, if there is a definite link at your right hand for this holistic care and one at your left hand, would you say nutrition and like counseling? What would be the best package that you would say to anyone watching this? Make sure you're doing these things together.
So, and that's kind of funny because you can't take anything out sometimes, right? Because coming from God created us, right? And so if God created us in a certain way, he also created us to live a certain way. So the aspects of health that I was talking about, we call them the 5 essentials of health. And we call them essentials because you have to be doing those things if you want to be healthy. Just like I said, you could be, you could go get adjusted once a week. You could be eating great. You could be exercising all the time. But emotionally, if you're going home into a super stressed out environment at home, whatever it is, you're overwhelmed by whatever's going on in life, then there's going to be a hole there in your health. And so that's why it's somewhat all-encompassing, is that you need to be doing, at least striving towards those things in every aspect of health, because there is not just one solution for everybody. Sometimes it's just filling in all those gaps. So I'm sorry so again, to answer your question, I'll say this, like our 5 essentials, they're chiropractic, meaning your spine, your nervous system, nutrition, exercise, and oxygen, just making sure you have plenty of oxygen, lean muscle, minimizing toxins in your life, and then making sure your mindset. So whether it's coming from a Christian spiritual standpoint or just minimizing the stresses in your life, because you got to be doing at least some of all those things if you want to be truly healthy.
No, I think that you did answer it. I set you up.
Okay.
I was thinking about, again, one of the things at Dream Center's Women's Clinic is the women who typically come to the clinic are forfeiting something in their life,
right,
out of necessity. And maybe it's been just a long journey to even get to the place where they're putting their medical needs in front of them and making it a priority. Because
right,
a lot of times they're coming out of situations where maybe it's been a cost factor, or maybe it's been a transportation factor, or maybe it's just a belief factor that I'm not good enough to have this treatment or to put this whole piece together. And so oftentimes what we hear is, I can't do this. It's not important. Taking care of my kids is the most important thing if they're moms. And so I just answered that.
Well, to that point, health has to be a priority in your life, just because, I don't know if you guys know this, but one of the biggest reason people go bankrupt in our country is due to unpaid medical bills, right? And so at some point, health has to become essential in your life or a priority in your life. And you mentioned your kids, and obviously kids are a priority and all that. But if you're not healthy, you can't take care of your kids, and you could actually end up putting more harm and stress on your kids if you're not personally taking care of your own health. So health is one of the most important things that you have. Just because, how far would you drive? How much money would you pay if you lost your health tomorrow? Whether that's a diagnosis of heart disease, cancer, what have you. But you do anything just to get your health back. So we always tell people is like, this is something that you have to invest in. You should be investing into your health, and even if that means budgeting for it a little bit more or throughout the weeks and months, but to a degree, you just have to be prioritizing it, and that's why I love the Dream Center so much. Is just because it opens up that opportunity to a lot of different people that otherwise wouldn't be able to, and so we love coming there just because it's like it gives us the opportunity to serve without ever even thinking about money, finances, the office overhead, whatever it is. It's just literally, how can I help you? How can we get you to a healthier state?
Wow. Thank you for that. Your heart certainly does lead the way. What you're doing, it's most appreciative, really, from every woman at the clinic who